Hello everybody, you're welcome. I'm here today, still at work to talk to you. You're welcome. Thank you for those of you who have had your procedure and have allowed us to share your pictures. We are so grateful. We want to let you know that we appreciate what you have done by sharing your story with other people. We are so grateful. Then we have those that don't want to share their pictures. We also understand. And we appreciate the fact that you trust us and you come to do your procedure. Just had a consultation with two ladies, and they need a tummy tuck, and talk about tummy tuck today. We've spoken about tummy tuck a lot in time past, but I think we should still talk about it. So I will talk about what is tummy tuck, how long does the surgery take, when can you resume your normal activities. Those are the commonest questions people ask. So first of all, tummy tuck is a procedure that is like tucking the tummy. So who are the people for tummy tuck? They are usually people who have had several kids. As I go, you understand what tummy tuck is more. It's those who have had weakness in their muscle wall. Most of the people that I've done tummy tuck for are women. I've suggested it for some men that their tummy is just too big. But for most people, it is women that we do tummy tuck for. So in tummy tuck, we assess some factors. One, we assess the muscle weakness, what a lot of you call the rectal diastasis. When there's serious muscle weakness, what you have is a protrusion of the tummy wall. So you have the tummy wall protruding, the whole abdominal wall protrudes. So you now have, when you relax, you see that the tummy is big. When you suck your tummy, you see that the tummy gets smaller. That is a sign that your muscle wall is actually weak. It's not really I wouldn't call it a hernia. It's not technically a hernia, but it's actually a form of hernia, where your intestines, your stomach, all that push through the weak muscle wall, and by pushing through, they give a bulge. Now, it's very common with people who have had several kids, and that is a muscle weakness. The second thing we assess is the excess skin. The skin changes. And when I talk of the skin changes, we talk of a stretch, because of, again, for the same reason, you have stretching of the muscle wall, stretching of the skin. That gives rise to this excess pouch that you have in your lower tummy. So you see that they have a pouch. Let me see if I can draw that. So let's see. So I talked of tummy tuck, you already know that. So you now have, this is, let's say this is your muscle wall. You now have this pouch like this. This is the excess skin. Now this excess skin may also come with stretch marks. So when you have that kind of thing, this is an exaggerated one, but some people have what you can describe in those. So you now have that excess skin. That excess skin is a sign that the skin has been overstretched. So you have people coming and say, oh, just do a liposuction for me. So if you have this muscle wall weakness, they usually corresponding excess skin, and then sometimes there are stretch marks on it. If you just do the lipo, this skin may not be able to retract very well. In most cases, it do not retract very well. So just doing a liposuction alone is not good enough. A tummy tuck is necessary in such a case to tighten the excess skin that you have. That's why we do a tummy tuck in such situations. The third thing we look at is the fat accumulation in the tummy. So the very fact that you have excess skin, muscle weakness, does not preclude that you may also have excess fat. I mean, most people may have excess fat along with these other changes. So what do? You have to do a liposuction. So you now see that when you come, we say you need a liposuction and tummy tuck. Now, so if you don't do a liposuction, you just do a tummy tuck straight away. Because some people say, look, it's just my tummy that is my concern. I'm not bothered about having a good waist. Of course, that's before the surgery, they say that. I just want this tummy to go. But the tummy is not in isolation. The tummy is connected to the back. And the tummy is not just about the muscle weakness. The things giving you the bulge are a combination of the excess skin, the fat, and the muscle weakness. These are the three factors that make you have that big bulge that you're talking about. If you only address the muscle and the skin, you still have a big part of fat that has not been taken care of. That part of fat will not allow you to have that flat tummy that you need. So what you need is to handle these three together, which is why a liposuction is necessary, a tummy muscle repair is necessary, and then you also have a liposuction. Those are the three I do for almost all my patients. I advise them do a liposuction. In addition to reducing the fat part in the abdomen, liposuction also gives you a good shape because the fat in the tummy is connected to the fat at the back. So it allows us to give you a 360 lipo, and ultimately that gives us a better outcome, even in the terms of closing. So this, in summary, is the description of tummy tuck. So if you have any of these that I've discussed, you have the excess skin or the muscle weakness, then you need a tummy tuck. So if you come around with any of these, most times we advise you, please, you need a tummy tuck. Now, when can you have this procedure? First of all, you need a consultation. For you to have a tummy tuck, you need a consultation, either a video consultation or a clinic consultation. And you can book me very easily on EasyCare. Just download the EasyCare app, EZZYCARE, and then you book an appointment. Or you can just contact the customer service directly and they book you to see me. It's that easy. Now, after the consultation, you usually get a bill for this. The next question is, how much does it cost? The bill includes the surgery, it includes the aftercare, it includes the massages, it includes the dressings, and if you have any medical condition that will need a second opinion, you also need a physician to review you. But everything is included. So for all our patients for tummy tuck, we prepare to do a central line. Now, a central line is a special line that doesn't block easily. You can carry it for several days. So for all our tummy tuck clients, we do a central line for them. We'll explain what a central line is to you. Usually after you make payment, we'll book you for the procedure. We'll give you a date. It's not in isolation. The tummy is connected to the back. And the tummy is not just about the muscle weakness. The things giving you the bulge are a combination of the excess skin, the fat, and the muscle weakness. These are the three factors that make you have that big bulge that you're talking about. If you only address the muscle and the skin, you still have a big part of fat that has not been taken care of. That part of fat will not allow you to have that flat tummy that you need. So what you need is to handle these three together, which is why a liposuction is necessary, a tummy muscle repair is necessary, and then you also have a liposuction. Those are the three I do for almost all my patients. I advise them do a liposuction. In addition to reducing the fat part in the abdomen, liposuction also gives you a good shape because the fat in the tummy is connected to the fat at the back. So it allows us to give you a 360 lipo, and ultimately that gives us a better outcome, even in the terms of closing. So this, in summary, is the description of tummy tuck. So you come for your procedure. It's not that you do consultation today and they'll book you tomorrow. No, usually some weeks ahead we book you. And then before the procedure, you come around, we'll do your blood work, all the tests we need to do, the ECGs, if we think you need to. everything that you need to do, all the preparations for any other procedure will pass you through them. Then, a few days to the surgery, they'll give you a call, tell you what you need to do, what not to do, and all that. Once you are ready, you would have your procedure done. And then the question is, how long does the procedure last? Usually a tummy tuck lasts between 4 to 5 hours. That's how long it takes me. It can be shorter, depending on your body mass and other things, but essentially we want it to look good. That's why we don't rush the procedure. And somebody say, oh, am I going to be asleep for the number of hours? Those number of hours don't really change anything. If you are medically fit, then you can actually be asleep for 10 hours or even 12 hours without any issues. It's when somebody is not medically fit that is concerned, oh, can I be awake? Can I be asleep for that long? Asleep for 5 hours is very, very normal in surgery. And you won't feel it. When you wake up, you just feel like it's a blink of an eye. That's the truth. You don't feel anything. So, 4 to 5 hours, you're out of theater. And what you do in theater is exactly what I've told you. After all the preparations, what I do is that do a liposuction first of your tummy, your back. Most times we do the arms. For some people, they may want a fat transfer as well. So for such people, you can do a fat transfer for them to the hip area to feel the hip dips. It's always good. If you have hip dips, you can do a fat transfer along with the tummy tuck. And then we also want you to do the arms. The reason why I want you to do the arms is so that your new body matches. A lot of people say, oh, Dr. Paul, I don't want to touch my arms. The arms are part of your body and they are part of your beauty. When you don't do the arms, you just do the rest of your body. Your waist gets small, your hips may get big, but you now look big up. So it's like an X. You know, an X is an exaggerated figure 8. It's too much. You just look broad here, narrow at the waist, and then broad down. So it doesn't look fine. So I want you to preferably look narrower up, then at the middle, and then you can have your hips more exaggerated, or at least let it match. Not that you have very broad shoulders and then your hips don't also go. So in the theater, what I do is that after the liposuction, I make my incision. We have all the equipment for that, and I recreate the belly button. When we talk of recreating the belly button, it's not that we cut the belly button, because I've seen a lot of people, a number of people come, and where they did their tummy tuck is that they cut the belly button and reattached it. I've seen it, especially those who did their surgery outside this country, or those that were done by non-plastic surgeons. Because of the difficulty, because they don't understand how to recreate the belly button, I think that's one of the easiest things to do. But because they don't know, they chop off the belly button and then they now draw the skin down and just place the belly button as a skin graft. And that's not nice, because that means the belly button will not have any sensation. That is, if it survives at all. And most times it will shrink and disappear completely. But we recreate the belly button, and it's a special technique that we do. It's very straightforward. We've done scores and scores of them, so we can usually do it with our eyes closed. But that's what we do. We don't cut your belly button. What we do is that we create a donut around the belly button. We pull the skin down, then we trim the excess skin, then we make a hole on the new skin, and then bring out the belly button and attach it to the skin. So your belly button is still there. It's just that we enucleate it, like a donut, and it drops in. We pull the skin over it, then we bring it out. That's simply what you do. And then we repair then before that we repair the muzzle wall. Bring the muscles together. The muscles are visible. You can see them. We don't enter inside the intestines. We don't see intestines. We bring the muscles together. The diastasis recta, we just pull it together, and essentially when we bring it together, we've repaired the muscle defect, and most people are happy after that. We repair above the belly button, we repair below the belly button. That's the muscle repair. And the belly button repositioning, we usually repair the lower skin. Is from one side to the other. but at the skin crease, so that when it heals, even if you wear a bikini, it is covered. And I usually use 2 layers of repair. I'll use the absorbable inside, which is actually the strength holding part of the suturing. Then I usually like putting skin stitches as well. Not too many, but I always put skin stitches. And then we'll put a drain. The purpose of the drain is to let us know if there's any collection. Usually there'll be some collection, but we don't want it to be too much. And by taking it out, we virtually reduce the chances of you having a wound breakdown, you having an infection, and all that. And we'll leave the drain for about 4 to 5 days. After that, to remove it, and you can go. So we keep tummy tuck patients on admission for 7 nights minimum. You can stay longer if you want in the aftercare. Thereafter, you'll be coming to see us for massages, for dressings. And we'll take out the stitches finally around week, around the 13th, day 14. Those are the external stitches. And you're good to go. For the first few weeks, you may not be able to stand that straight, but gradually you return to your normal activities. And by 4 to 6 weeks, most people are back to their normal activities. So in summary, this is how a tummy tuck goes. And people say, oh, I'm scared of the cutting. No, you shouldn't be scared. I mean, you turn out very, very well. You've seen so many of our tummy tucks, and that's how yours too will be.